coming in. That's great. Well, welcome everyone to this afternoon session, and welcome to those of you who are joining us for the first time. Welcome to those of you who are coming back to our conference. And our event is the place of philanthropy and community mental health. So we're really excited to see our speakers today and everybody in the audience. That is exciting. The session that we're going to have you listen to is entitled "The Role of Philanthropy in Filling Governmental Gaps in Mental Health Supports." And I'm incredibly thankful and we're so fortunate that Dara Parker from the Vancouver Foundation has kindly agreed to moderate this session. For those of you who might be a little bit tired of my voice, we'll have Dara freshen things up for us. So thank you, Dara, for being here today with us and for doing a bit of heavy lifting with us. For those of you who haven't met Dara, she's a nonprofit executive with over 20 years experience working in social purpose organizations. She's currently the Vice President of Grants and Community Initiatives at the Vancouver Foundation, where she leads a team of 17 individuals and is responsible for deploying 15 to 20 million in grants annually. And she also has just wonderful 2 puppies that have fabulous names that she has shared with us to keep her, happy and running at the end of the day. So Dara, I'm going to pass the torch to you to introduce our speakers and make some opening remarks.
Thank you so much. And you left a real teaser there. You said they have interesting names but didn't share them. So now I feel obliged to let the people know what they want to know. Yes, I do have 2 French bulldogs. The older brother is named Mr. Bumper, and Sir Waffles just joined us 4.5 months ago and is just a reign of terror over the house. So we'll share pictures if there's time. Thank you so much for having me today. I wanted to start by sharing that I'm calling in today from the unceded territories of the Selkirk people. I'm really grateful to be a guest on these territories. This is a new home for me, and just wanted to take a moment to reflect on what it means to be an uninvited guest, and especially moving to a region where there have been horrific headlines over the last week, and just reconnecting to my commitment to understand what it means to be that uninvited guest, and my relationship with First Nations people across this country we call Canada. I also have the privilege of serving as that Vice President of Grants and Community Initiatives, as I was introduced, at the Vancouver Foundation. We are the Vancouver Foundation. Our mandate is to serve across BC. And as a community foundation, it's critical to us that we take direction on how we do our work from communities. In fact, our tagline is community inspired. And that's because we believe that local knowledge is incredibly powerful, and that those closest to the issues that they're addressing should be leading the response to the issues. That proximity is important, and not just important, but critical. And so I'm excited that today we're going to hear from some of the folks who are doing just that. I'm delighted to be able to highlight some of the incredible community leaders who have stepped in where they've identified government gaps in services. And so we've got 4 different groups we're going to hear from today. And I want to start by introducing you to, and I have not double checked on pronunciation of names, so I'll invite our guests to correct me if I get it wrong. But our first group is Katrina Verschoor, Kim Rawkins, and Sandi McCreight, who are going to share more information about their program, Increasing Recreation Involving Seniors, that they initiated last fall with the Castlegar Community Response Network.
Hi, everyone. My name is Kim Rawkins, and I'm a nursing instructor at Selkirk College in Castlegar. I'm also a dog mama, and my dog's name is Hank. It's not quite as cool as Waffles, but it's not bad. I'll just get our presentation up. All right. So I'd also like to start with a land acknowledgement. I'd like to show deep gratitude to the First Nations of the West Kootenay and Boundary regions upon which I reside, and all our research that I'm going to tell you about took place. So that's the Sinixt, the Selks, the Katunaha, and the Secwepemc peoples. So today I'll be presenting on a research study which my colleagues Katrina and Sandi and I did on the impact COVID-19 was having on community dwelling seniors in our area. So both Katrina and Sandi are here today, and they'll be contributing to the presentation and answering questions and conversing afterwards as well. Katrina is also a nursing faculty member at Selkirk, while Sandi is the founder of an impactful community-based program that supports seniors' well-being. And it's called IRIS, or Increasing Recreation Involving Seniors. So recently, to do this research, we've been partnering closely with Sandi to find out what the community needs were. So when COVID was deemed a pandemic, I was very pregnant and teaching my nursing students from a desktop computer, and I felt helpless. I knew that, countless grandparents were struggling with the fact that they couldn't hug their grandchildren, and about to have a baby myself, and my parents and in-laws weren't going to be able to meet the baby. And I started talking to one of my colleagues about what I could do and how I could do more. And I was just finishing my master's program as well. So my colleague said, well, you should call Sandi. And so our research study was born from that phone call with Sandi. And I pitched a bunch of ideas to Sandi. And eventually she kind of slowed me down and tempered my excitement a little bit and said, maybe we should ask seniors what they need. And so that was a big lesson number one for me in developing a health initiative, was to do your homework and listen first, because all your work can be amiss if you are thinking your ideas are right and you haven't talked to your community. So it sounds like that's a lot of what the Vancouver Foundation does too. So I should have read your slogan before I headed down this path. So as I reviewed the literature on how seniors were coping across Canada and the globe, it became clear that more research on rural populations and corresponding supports were needed. Again, I was just finishing up my master's and looking for a capstone project. So this was a really good fit that I could try my hand in research. I hadn't done anything like this before. And Katrina, my colleague, had a little more experience in this area and keenly jumped aboard. And we also hired a couple research interns. One was a nursing student and another had just finished her business degree. So we had a really great team it was a diverse team for sure. And it was really nice getting students involved as well, because the fresh ideas from students that hadn't already worked as nurses was really great. So at the time, due to the recent nature of the pandemic, little research had been done eliciting data on the impact COVID was having on the health and wellness of seniors from their perspective. I read a lot that was written by physicians on their perspectives on the impact COVID was having on their patients, but there were very little firsthand accounts, especially from community dwelling seniors, on how COVID was impacting them. And also, many of the studies that have been done were surveys that were mostly closed-ended questions. So our study was somewhat unique in that it used many open-ended questions, and it allowed for seniors' voices to really be heard. So who better to guide the communities and practitioners on how to best support seniors than seniors themselves? So today I'll be explaining our research findings and sharing how we've used our data to develop some health initiatives in our rural community. And then Katrina will be concluding with the main benefits and takeaways from our work. And then after the presentation, Sandi will be available and speak a little bit about her nonprofit and how it's supporting research and these connections with students and these intergenerational relationships with seniors. Okay. So the objectives of our study were to explore how seniors believe their mental and physical health has been impacted by COVID, and also elicit ideas from seniors on what they feel would be some great supports during the pandemic. So we started this survey, we ran it over last summer. So the second wave hadn't hit yet. And spring, summer was when the public health guidelines loosened a little bit. So it was really nice because we could implement some of our health initiatives, and then the guidelines tightened up again. So we've had to be really innovative and flexible, and our ideas for health initiatives have shifted around a lot, but it was really great to get seniors' take on it and what supports they thought would be useful, and then try and figure out how to make it happen in a safe fashion. So to gather this information, we recruited participants through IRIS, Sandi's Sandi's organization. We also advertised on local radio and newspaper, and the survey was offered online via SurveyMonkey and on paper and by telephone interviews. Sandi and her team of volunteers have been delivering lunches to seniors in Castlegar throughout the pandemic. And the lunches are accompanied with a newsletter. So we slid our survey in there. And so that was a really great way to connect with seniors without putting them in danger in any way from close contact. So at that time, we didn't know too much about COVID. So we were trying to figure out a safe way to get the survey out there if people couldn't get online. So most of our participants were females between the ages of 65 and 74 who lived within the city of Castlegar. All right. So I'll just get into our results a little bit here. So prior to the pandemic, 15% of our respondents stated they had felt moderate to severely lonely. And then this increased drastically to 65% after the pandemic began. So as you can see from the results on the right, majority of the seniors we surveyed felt their mental and physical health had been negatively impacted by the pandemic. I also want to add here that there were some responses which indicated the pandemic had had positive effects on people's mental and physical health. They were sort of silver linings that the research team went, oh, I didn't think of that, and how COVID could impact someone that way. For example, some stated they were getting more exercise as they could no longer have people coming into their homes to support with cleaning or yard work and things like that. So there were a few things that we hadn't thought of, and we really appreciated how many of our respondents had found this silver lining, and they were great stories to share with other seniors because they promoted hope and showed resilience and things. So I'll get more to that later. In that vein. Okay, so when we themed our data, we came up with some prominent themes, both under the mental health and the physical health realm, which we know are very interrelated. So when asked about the impact of COVID on their mental health, social isolation was one of the main themes, present in 33% of our responses. It was mostly related to the inability to see friends and family or make social connection with others. I have a quote here. One senior stated, "It's stressful to have lost my social outlet, which was grocery shopping for myself. I'm totally alone most of the time. No family here. Friends are old too." Another prominent theme was fear and anxiety in 19% of our responses. And of these responses, 70% were related to transmission of the virus, both to self and others. Again, we have to kind of shift our thinking back to when we ran this survey and we didn't know as much about COVID as we do now. So I suspect that would be different if we surveyed again. Another theme was depression, present in 25% of our responses. One senior stated, "I cry more often. I feel sorry for myself more. Sometimes I feel ungrounded mentally, and I do better when I get to see people." So in regards to physical health, the main themes were exacerbated health issues, decreased activity due to less opportunities to safely recreate, and changes to access of healthcare services. And those were our most common themes here. One senior stated that it's hard to get up and get going when there's no place to go. Consequent inactivity has caused physical deterioration. So stiffer joints, more achy, more tired. So services such as massage and physio and exercise classes were totally canceled in the beginning. So that was when we were running our survey. So again, I suspect this, as people pivoted online, this might be a bit different, but it was definitely a huge barrier to seniors' physical health in our area. And the last theme that we noticed was present in many of the responses to questions related to physical and mental health. And our research team, as we were theming it, we kind of, hey, did you guys notice this? There's a lot of talk about these things that people miss, and they're grieving these loss in routines and rituals, changes in employment. They're not able to volunteer where they used to anymore, and grieving the loss of social connections and loved ones and relationships. And it percolated throughout our survey. So we felt the prominence of this theme might be related to age, although we all agreed on the team that we were feeling this grief as well. But we thought that from talking to many seniors that perhaps time has a different meaning to us as we age, and seniors might be feeling this grief more profoundly than other age groups, because they might feel they're being robbed of their quality of life and routines as they're nearing the end of their lives. One response that clearly illustrated this theme was, I feel dispirited. There's little to distract from the constant barrage of gloomy news, and with little hope that there will be a return to the norm in my lifetime. So I think it's easier as a younger individual to say, hey, I'm going to see the end of this. But perhaps with age, it's harder to see that light at the end of the tunnel, although we are seeing a lot of positive coming out of all these vaccinations. So it's great. All right, and some of the suggestions that seniors had for us that they felt would be helpful moving forward were more opportunities to safely recreate and socialize, such as walking groups was recommended by lots of the seniors we surveyed. They also called for more clear and current information on COVID and the associated public health guidelines. So if we can think back, it was changing a lot at the beginning of the pandemic. So we designed a health initiative with the students to sort of address this coming up in our survey so often. So what did we do with our results? Well, we designed a couple amazing health initiatives with some nursing students that we partnered with. In addressing the need for safe social connection and exercise, the nursing students partnered with IRIS and started an outdoor walking group. So you can see them all masked up here. And they did run it inside one day. And then winter started to hit, and so it wasn't possible. And then things tightened up with the second wave. So that they ran it for quite a few weeks, and we got lots of really positive feedback from the seniors that attended. The students also organized a COVID info session for seniors to address this need for more current and clear information on what the public health guidelines were and sort of what was happening with COVID in our community. So the seniors got to attend a coffee group, all safely distanced inside, and we just had a limited number of seniors attend. And they learned about COVID regulations, proper ways to put on a mask and don and doff, as well as sharing their stories of the impact COVID was having on their lives and sharing those stories of resilience, those silver linings. And a lot of the seniors just couldn't say enough about how nice it was to sort of just share how it was going with some other seniors. So unfortunately, when things tightened up again, we couldn't do any more of these, but it was really great to see how this could work again later, maybe in an outdoor setting or running it again. So another part of this, after we realized how great it was to share these stories of resilience, the nursing students helped with the IRIS newsletter that goes out with the lunches every couple weeks. So what they did was they'd call a different senior each week on the phone, and it was totally voluntary, and they'd chat to them about the impact COVID was having on their lives and some coping mechanisms that they'd found helpful. And then they wrote a little column about that senior with their permission in the newsletter. So that was a really great way of sharing things around and fostering that social connection, both between seniors in our community and between the seniors and the students. So lots of really great intergenerational relationships came from all these interviews that were happening over the phone. And the last initiative that we just wrapped up recently, we had student volunteers from various disciplines. So nursing, we have a rural pre-medicine program here at Selkirk, as well as social work students. And we had them call and have phone conversations with seniors once a week. So they'd chat for, half an hour to an hour once a week. And it wasn't focused on COVID, but about this, whatever they wanted to talk about, really. And we had some guiding questions. And so the senior could share a little bit about their lives, whatever they were comfortable with. And then they had an option to make a photo storybook with their senior partner in the end. So the books are just being put together now for some of the seniors, and we've had a focus group with the students and done some follow-up phone calls with seniors. And it seems that it was really, really a great initiative, and both the students and the seniors really enjoyed their time together, and some of the relationships seem like they're going to be a long-lasting relationship. So it's really great to see.
Yeah, I thought one of the overriding things that we discovered, and I probably don't need those, Kim, that's fine, is that I think what we discovered was that COVID actually just brought into more clear focus, like many of you have stated, issues that were likely pre-existing prior to COVID, and highlighted the populations at risk even more so. And so when we look at that, and from a college perspective or an institution of education, and looking at the role of philanthropy in meeting the needs of our communities, we really felt that we needed to pay more attention or put a lot of effort into actually building humanitarian competencies within our health and human services students. And then how do we do that? And so looking forward in how both Selkirk College wants to work with IRIS and maybe other community organizations, nonprofit organizations in the future, is really looking at how can we start to embed these community-based learning experiences for students. When they can get in to the community, they can start assessing what the needs of the communities are right at the front line with the people that are doing the work, and then actually working with those institutions to actually deliver services to meet the needs. And I know for many colleges and universities send their nursing students, for example, and other students out to third world countries to help in humanitarian efforts. But I really think what the message from today is, from everybody who's presented, is that we have a huge need within our own country, and a huge need to build capacity within our own country to help meet the needs of our population. So moving forward, we're really excited. I would really love it if any of you don't know Sandi McCreight and what she does through IRIS and Castlegar, to touch base with her, to learn about what we're doing and where we would like to take this in future. The other thing is that what has come out of this is the importance of connection. And I think you've all spoken to that today. The importance of making, creating relationships and creating bonds. And I think the acronym LOVE would likely fit in all of the different situations we've talked about today. We certainly have found that both with ourselves in the research that we've done and the projects we've done, our own perspectives have changed, as well as our student perspectives have changed. And one of them is it isn't us and them, it's us as them. So seeing how the people that we are serving are actually very much tied to who we are, and that we're not two distinctly different entities in the social context. So I think I just wanted to end with that. I think that there's a huge need to really grow that type of competence within our institutions, within our education systems, and just grow the passion for that type of work. So I'll leave it at that.
Thanks, Katrina.